Thank you very much. Welcome again. This is Hasnain. My name is Hasnain Kermali, the Chief Medical Officer here at St. Mary's Hospital, and welcome to another edition of our Facebook Focus Live. Of course, St. Mary's Hospital, located here in Waterbury, Connecticut, part of Trinity Health of New England. Each month, we like to bring you one of our clinical expertise and clinical opportunities for our community that we're able to offer and provide to you and share with you the expertise that we have here within our system. This month, we're really excited because we're joining Dr. Abe D'Amato, who's one of our urologists who partners in our Men's Health Institute. He's an experienced urologic surgeon, provides a huge benefit to our patients here in Waterbury and across Connecticut. And we continue to strategically grow in a number of areas, men's health being that focus as well. And we'll get to all of that in a couple of minutes, but let's begin with you, Dr. D'Amato. Thank you very much for joining us today.
Thank you so much for having me.
Appreciate it. So a Colorado native, ended up on the East Coast and doing your residency here, in Long Island at Stony Brook, and joining Trinity Health of New England in 2022. Give us a little bit of your story and what brought you to urologic medicine.
So my story is fairly atypical for urology. The vast majority of people who find their way into it have a surgeon in their family they may call dad that sort of guides them into this particular niche field. I had actually gone into medical school. I thought I was going to do primary care. I had grown up in a small community in Colorado. I thought I was going to go back. And that lasted right until I did my first surgery rotation.
Okay.
It became very obvious that I was a surgeon. I needed to be in the operating room. That was a big step. But I didn't love general surgery as much. That was very much somebody comes in, they have a problem, they fix it, you may never see that person again. And I was looking for a balance between getting to operate and medical long-term care of people. I was very fortunate in my search. There was a chairman of the Department of Urology at the VA Center in Denver who had sort of heard about me and heard there was somebody looking. He pulled me out of another rotation and stuck me on urology for a week. And I mean, the rest, sort of wrote itself. But I was very, very lucky that Dr. Donahue, heard about me and pulled me into urology, because it's been a wonderful, blend, and it fits my personality and me perfectly.
That's such a beautiful story. And to have a mentor like that, to have identified you at such an early stage and say, hey, we've got a great opportunity for you, come by and take a look at this.
Yeah.
That's great. I remember for me, it was the exact opposite. I knew I wasn't going to become a surgeon when I got onto my surgical rotation and said, hey, we're going to do something different. But tell us a little bit about the conditions you treat. Urology, like you mentioned, is a breadth of medicine, not just surgical, but has other pieces of the puzzle.
So, yes, urology primarily is surgery. We do a lot of operating. But I would say only about 5 or 6% of my patients end up actually needing some sort of operation. I see a lot of people for urinary symptoms. Women tend to leak, they go too often, they go too much. Men tend to have trouble getting the urine out and may again end up feeling like they're urinating too often. And those sometimes are things that we can treat with pills, with diet, with exercise, and people can get a lot better. There are things we can get into surgically down the road, although, again, only a small percentage of patients are bad enough to require that. I deal with a bit of fertility. Not a ton, but we do see people with fertility concerns and can be beneficial for men that are having trouble conceiving. I do a surprising amount of testosterone replacement therapy, which can be very important in middle-aged and older men who are feeling that they have low energy levels or lack of interest in sex or having trouble with weight loss, and just not feeling very well. And we see a dramatic number of people with low levels. And it's really unclear why it's as common as it is, but we do see a huge amount of it. And again, in the appropriate person, being on that sort of replacement therapy, that medical therapy, can be a huge difference in their quality of life.
Yeah, and it's remarkable how much we're putting the patient in the center of that discussion. It's not simply a diagnosis and then, like you mentioned, you send them off to the sunset. You're making sure that you're helping them with their entire life. Going too frequently, for example, even on road trips, can become changes a 5-hour drive to a 15-hour drive at times, or maybe not that drastic, but clearly the impact that you have on their life is tremendous. And so thank you for continuing to do that. But let's talk about the surgical portion of urology. I think there's some exciting things that are happening in the world of surgery when it comes to urology. Give us a glimpse of that.
So the most common surgical condition that I treat would be kidney stones. They're ubiquitous. We think that about 1 in 12 people will experience a kidney stone at some point in their lifetime. So it's a very, very common condition. Now, some of the stones are present and don't cause a problem. There are a lot of stones that people are able to pass without me having the benefit of operating on them, which I know is very disappointing to those patients, but ends up being good news. But when we do need to operate, we have a lot of minimally invasive surgeries. We don't usually have to make any incision on the skin. We're able to either use ultrasound waves to shatter stones or go up through the tubes that are already there to extract even very large stones. That's been helped a lot because the laser technology that we use for breaking up stones has come leaps and bounds. Even in the 10 years that I've been out since residency, the machines that we have today are a night and day difference from what I trained on and what we're able to do.
Wow.
So for me, stones is a big deal.
Okay.
I see a lot of men with enlarged prostates. Very, very common. As men get older, the prostate continues to grow. It's just like our ears and our ego. It all goes together. But as that prostate...
You just said men's egos continue to grow. We'll have to keep an eye on that.
But it's a very common thing. And by the time men get into their 60s and 70s, again, it's probably about 75% have some degree of urinary difficulty.
Sure.
Maybe it's enough for pills. Rarely it's enough for surgery. But there are a lot of things that we can do for that. We see a fair bit of cancer. There's actually a fair amount of bladder cancer in the Naugatuck Valley, probably as a consequence of the old industrial processes that had taken place here and some environmental contamination. In that regard, we're very happy to have welcomed Dr. Doran into the group recently. He had been with Hartford Hospital for a long time, and we were able to entice him to come over. That's been a huge thing for us because we weren't doing the big oncology surgeries, and now we can offer that here locally.
Yes.
And, St. Mary's has really risen to that and takes great care of these patients, and we're having really good outcomes. And so that's a big benefit to our community as well. And a big attribute to growing this men's health program and urology practice in general in the Valley.
Well, and when I think about the urology and the Men's Institute that we've got here at St. Mary's Hospital, it truly takes care of the male in all of the various aspects between the urologic management, the primary care management, and then even the surgical management. So I think what you all have put together has been great, and now being able to add on oncologic and treating their cancers through surgical management right here in our own backyard. Again, our focus remains that we want to manage the patient as effectively as we can here in their community setting. And so I'm really excited to have had that opportunity to bring that here. And that goes along with, when we talk about the robot and the surgical robots that we have here at St. Mary's and being able to use, again, those minimally invasive procedures, quicker turnarounds,
much less downtime, much less time in the hospital. Most people come into the hospital thinking they're going to recover here, and then they actually spend a night. They realize, this is a place to be if you cannot be somewhere else.
Yes.
But the sooner you get out, the sooner you're back to your own bed, your own food. That's when you actually start to recover.
Yeah, and it's very true. But and that's why having that surgical robots that we can speed that process up. But there's something new that we're also offering. We talked about prostate enlargement, and we're able to now offer the first in New England aquablation with the new Hydros robotic system. Give us a little bit of insight on this.
So this was a system that's been in development for a long time. It's been out in one form or another almost a decade now. We were lucky enough to get the newest iteration of this robot. It's sort of reinvented a surgery that's been around probably as long as I've been alive, maybe longer, designed to open the prostate up so that men who are having trouble getting the urine out, who are obstructed from this enlarged gland, by removing the center, sort of like coring out an apple, that prostate no longer obstructs their flow. They urinate much better. They're able to sleep through the night. They empty more completely, and because of that, they go less often. We've had a lot of different surgeries over, the last 100 years that we've been operating on prostates to try to improve this. The aquablation really offers some new therapies because although it's done in the same minimally invasive fashion by going in through the urethra as a traditional transurethral resection, because it's robotically controlled under real-time ultrasound guidance, I can know exactly where I am when I'm resecting tissue and removing things. It allows us to achieve the maximum degree of opening of the outlet while at the same time avoiding any potential injury to nerves in the area, so we don't have trouble with erectile dysfunction. We protect the external sphincter so there's no risk of urinary incontinence, and we're able to do special work around what's called the veru, or where semen is expressed, and preserve normal sexual function, which for some men is very, very important. Whereas the older surgeries, although they were just as effective at opening men up, had more sexual side effects. And as men are living longer and are healthier later into life, that's really important.
Yeah, it's a lifestyle thing, and we've talked a little bit about that. For a patient, there's a lot more than just their medical issue. And in the past, we were able to say, well, we can do this, but you're going to have this, this, and that. We'll solve one problem, maybe create 2 or 3 others. Maybe that's still the case in some of the things that we do, but I think with this kind of therapy, we're focused not just on the problem and solving it in the same effective way, but at the same time, we recognize, hey, we got to make sure we're not doing those other things as side effects, and preserving whatever function it is, but allowing people to continue to live the life that they want to live on their terms, not on our terms, moving forward. And I think that's fantastic.
Yeah. I mean, that's really been the biggest change of this, is being able to offer the same benefit with fewer side effects, fewer complications. And it's one of those, this new robot makes it, much safer, much quicker. It's less time under anesthesia. So there's a lot of benefits to this new technology.
And this technology, I had read, has an incorporation of some degree of advanced intelligence as well.
So that was one of the big things with this newest iteration of robot. Although the artificial intelligence isn't perfect, it can do a lot in terms of helping guide me as I'm planning where I want to ablate and what's going to be left behind and where things are. And although I may not always agree with the robot, at least it gives me an idea of where it thinks I should be. It's sort of like having a coach behind you the whole time to make sure that you're doing everything right.
Right. And then you still got to shoot the buckets and score it. It's not just about the coaches. We just saw that in the games last night, and over the past weekend. Go UConn. So fantastic. So what are some of the other, so let's shift gears a little bit away from the aquablation. Or before we do that, what makes a person a good candidate for that kind of procedure?
So aquablation, again, is meant to open the prostate. So you have to have men that are having urinary symptoms because of obstruction. Although that is certainly the most common thing we see in men, they can still suffer from a bladder that itself is just overactive and spastic. And that's part of the workup of sorting this out. We need to know that the prostate is the correct size. One of the other benefits that aquablation offers is that me personally, I'm technically limited in how big a gland I can take care of.
Okay.
In traditional methods, it just becomes too long under anesthesia, too much burden, too much bleeding. The robot doesn't have that constraint. I mean, I've done some very large prostates, and guys are still going home the next day,
Wow.
whereas I wouldn't have been able to offer them that sort of intervention in the past. So we need to have information about how significant a man's symptoms are. That's something we monitor. Every time a patient comes in to see me, they're filling out forms, and I'm sure that many of my patients get annoyed that they fill out that form every time. But it really is important to me. I can see where their numbers are over time. I have an objective idea. How much are they suffering? How bad are their symptoms? What type of improvement did we have with pills? What type, where are we expecting to get to? We need to know really how well they're flowing. Again, in the office, we can measure the degree of obstruction somebody has.
Okay.
And that, again, lets us know that we're offering them the right surgery. We need to know how big the prostate is, which we can do with ultrasound.
Sure.
But having all that information is really critical in making the decision to go this way.
I mean, seeing that now expansion of offerings, being able to go outside the normal candidate and expand that horizon is, to me, again, a game changer for the community of Waterbury, because those ones who could not get the standard of or the old way of doing it, now they've got an opportunity to get relief, no side effects, and still be a candidate.
Yeah.
So, I mean, thank you very much for being that, and I know you all played a role in landing it here for Waterbury, so thank you very much for that as well. But we continue to be amazed at the returns on patient care that we've been seeing. Again, you're talking about patients leaving the next day when they would have stayed in the hospital for 2 or 3 days after a surgery.
Especially for very large prostates, would have required incisions on the skin to deal with, sometimes blood transfusions. I mean, although those things can still happen, it's significantly less common.
Right. So the good news is that this enlarged prostate isn't the only program that you guys have had that's been successful. There's another very successful program you have, and that's the stone program. You alluded to the stones being a big portion of your practice, but you have revolutionized, your team has revolutionized how stones are managed at St. Mary's. Tell us a little bit about the stone program.
So the biggest difference that we've been able to make is making it easy for patients to gain access to a urologist to discuss what to do. Traditionally, somebody gets an attack of a kidney stone. They notice that something's wrong because of severe pain. And it's the type of pain that people will say, listen, just shoot me. I don't want to. It is some of the worst that people can experience. Yeah. And we can get the pain under control, but then traditionally there was a lot of trouble because the lag time between being seen in the emergency room and being able to get into a urologist and talk about this could have been weeks or months. With the stone program, each urologist has reserved time in our schedule every day so that somebody who is in the emergency room over the weekend or the night before can just come to the office, come in and be seen so we can start the process of getting this fixed. Additionally, one of the nurses in the office is searching through the diagnoses that are given to any patient in the emergency room, and she reaches out to these people as soon as she finds them. So anybody who came in and there was a mention of a stone gets a phone call. Hey, listen, how are you feeling? Do you need an appointment to come in and talk about this? And again, it's trying to get those patients into care, get people seen faster, so that this can be dealt with. They're not going back to the emergency room.
And that to me was remarkable, because it allowed for a number of things to happen. Number one, the patient from the emergency room knew they had a plan of care. It wasn't sort of this, hey, call this number, they'll figure it out. There's such a great connection that not only will you call the number, but we know you're going to get seen like the next day. It's not even a question of perhaps, it's going to happen. And then number two, they're not languishing in the hospital. They're not waiting, till the evening, the urologist to finish their day and come in to see them, or get admitted up to the floor, see the urologist once, and then just sort of wait around for their discharge paperwork. It's immediate, it's action-oriented, and then they see you, and they know, and you know what the next steps are going to be, whether or not it's continued hydration, whether you got to go in and do something. It's fantastic. And yet it allows those patients that truly need to remain in the hospital for their stone management to be here, so that we know, hey, that's a stone that needs to be in the hospital. It's very, very focused for their care as well. So it spans that entire spectrum. It's again, for us to be able to provide that kind of access to the city of Waterbury is tremendous. So I want to thank you for coming up with that kind of focus. And the program we've got now 4 expert urologists here under our team. Tell us about the team.
So it's really led by Paul Moy. He's the chairman. I think he's been practicing in Waterbury close to 20 years.
Wow.
He has a wealth of experience. He knows how to make the system work. He knows everybody that's involved with it to help things get implemented and start these new programs. He's incredibly busy. That was his downfall, is he's trying to do so much.
And yet has time to go for a mission trip that he just came back
just
from.
was in Africa doing urology in the forest. I can't even imagine.
It's amazing what he's able to do. Absolutely.
And then he had trained with and was able to recruit Tony Kim, who's been maybe 2 years less than Paul, working here in the Valley at St. Mary's in Waterbury and taking care of everybody. Again, tons of experience, very, very talented surgeon, does a lot of different types of surgery. They recruited me just over 3 years ago now, because they were drowning in patients. They couldn't keep up with how busy everything was and what needed to happen to take care of people here. And my practice here has exploded and become very, very busy very quickly. That's partially because we do have a lot of great primary care doctors in the Valley. They do a great job of finding people and knowing where to send them, and having everything lined up so when they come in, they're able to get the care that they need. And of course, like I had mentioned, we recently added Dr. Doran, who brings a whole new set of surgeries and expertise to our group, whereas we had done what would be considered general urology, the basics that everybody comes in with. Now we're able to offer really high-level care, expert-level care in some very advanced cancers that we used to have to send people out of the system for, out of the city for. Now we can offer it right here and give them the same or better outcome that they would get anywhere else.
I love it. I love the continued focus on patients, and I love our continued growth in this field. I'm going to ask you a question and a new tradition that we've started here on Facebook Live. We're going to ask you a question that was asked to you by the previous presenter. He didn't know you were coming in. We're going to ask you to do the same thing. But his question to you: what is the most important thing that you like about your work?
So one of the things that really drew me to urology, although I love having the long-term care of patients, what I love with urology is there's a lot of instant satisfaction. Somebody with a kidney stone, especially if they're very sick and we put up a stent and drain that kidney, the relief is, as soon as they wake up from surgery, they feel different. The surgeries on the prostate, you do a surgery and there are some patients, catheter comes out and they pee for the first time in months. Right after that.
Right.
So there is this, I can see the effect that I have and the benefit to people, and it's not something that I have to wait months for, say, I think that you lived an extra, however many years, because the change for me is instant, within a week, within days, sometimes within hours, and that I love.
Beauty. I love that. So same question now to you. Question for you. To our next presenter, we don't, whoever that's going to be, ask them a question that we can have.
I would ask them, what's something that they love doing outside of work?
Okay. So what's something that they love doing outside of work? We're going to keep that on our agenda to make sure we ask the next time. And finally, we always like to leave our viewers with a nugget or a pearl from your perspective as a healthcare provider to the audience for the benefit of their health.
One of the things that I find that's very important to my own health, to my well-being, is having something besides work that's important, be it going to church, be it family. In my case, it's fly fishing. That is something that I can go. It lets me recharge, unwind, feel better.
Yeah.
And one of the benefits, of course, of coming down to Waterbury is people must wonder who the idiot wearing a bow tie in the middle of the Naugatuck River at 6 a.m. is. That's me, and that's a trout on the end of my line. They do live in that river.
Wow. So maintain a good life-work balance. Yeah. That's great. Find that joy outside of work that they can continue to connect with. Wise words of wisdom. Thank you so much. Once again, thank you again for joining us today. Really appreciate your time. I know you're a busy guy, so appreciate that. And thank you all for joining us as well. We look forward to seeing you next time. Have a great day.